In every hospital, the emergency department is a stressful place.
It's our role as healthcare professionals in the department to communicate with our patients, make sure they understand the processes and their waiting times and what they're waiting for and what investigations they're having done. And that brings stress levels down and it helps calm people. And when people know what their plan is, they tend to calm down and settle and await the process.
Data recently published by the Health Authority shows that Monday is the busiest day of the week at A&E. May and November are the busiest months of the year. The data's been used to try to plan for surges.
We've worked very hard in trying to decrease waiting times, get a lot of nurse-led initiatives into practice so that we can turn patients around quicker, give them the best care available according to the latest evidence that is emerging, and I think we've been quite successful in that.
But our emergency department remains difficult to predict.
Sometimes it gets busier and we can get overwhelmed and people do have to wait, but everybody in our team is doing their best at all times.
NHS guidelines for emergency departments is that patients should be assessed within 15 minutes of arrival.
We're triaging within 11 to 15 minutes, which is sort of the gold standard, and we're also building up our nurses in their skills and what they're able to do, practices to be able to give the patients extra care and sort of push them forwards, as perhaps not needing to see a doctor. Nurses are able to give a wealth of information to patients as well as doctors. We're a team.
The 24-hour service offered by 111 is helping to signpost healthcare users to the most appropriate care for their condition. That could be consulting a pharmacist or seeing a GP via the primary care centre.
We strive to see the right patient at the right time in the right place.
Of course, 111 could also direct you to the emergency department or an ambulance if they think you need it.
And in A&E, of course, we are there for everybody who needs us 24 hours a day. And if we get the patient selected appropriately, we can give the best service available to people who really need it.
If all services are treated with the respect that they need and patients are present there if they actually need to, I think it will make all of our services much more efficient.
This busy department is a work in progress, but the professionals leading it have had a good few months.
And I'm very optimistic and I'm looking forward actually how the year carries on.
They're confident they're heading in the right direction and they're passionate about the work that they do.
It's a vocation. It is the best job in the world for me.